Okay, here's the deal. ACLS won't work. It's not going to work at all, unless it's preceded by good basic life support, good quality chest compressions. Without that, we got nothing. That's our topic today, the review of the BLS Healthcare Provider Algorithm. Let's get started. Step 1, ensure the scene is safe. It's crazy out there. Your safety comes first. Next, assess your patient. Give them a sternal rub, poke them with a stick, try to get some response. If there's no response from your patient, your very next step, get some help coming. You cannot work a code by yourself. If you're in the hospital, call a code. If you're out in the population, you get on your cell phone, you call 911, you put it on speaker, you start talking to dispatch while you're continuing the arrest. Next, you're going to check for a pulse and assess for breathing at the same time. So you're feeling for a carotid pulse while you're simultaneously looking at the chest to look for chest rise. To cover the test question, you will do this for no more than 10 seconds. 10 seconds, that's it. Now at this point, the algorithm kind of breaks this patient into 3 possible scenarios. The first one being, during our assessment, we find that they have adequate pulse and adequate respirations. At this point, all you're going to do is watch this guy. Continually reassess the patient. Make sure they have an airway, maintain the airway if need be, but really we're just going to watch them for any changes until help arrives. Second scenario, patient has a good pulse, but inadequate breathing. If that's the case, we're going to provide supplemental breaths to a rate of about every 5 to 6 seconds. 1 breath every 5 to 6 seconds. Now in this scenario where you have a good pulse but abnormal breathing, today in America we really need to be thinking about an opioid or a heroin overdose. So assess for that, and if need be, administer the antagonist, Narcan.
We're gonna bring you back from the dead. Now I want everybody here to grab the hand of the person next to you. Come on now, we ain't got much time. Rise!
Frederick!
I'll be begging
Oh my
and
God!
start your life anew, Lord. Oh, thank you, Lord.
What happened?
Died, you stupid. I warned you.
Damn, you guys are good.
Not us. The first step is love. The second is mercy.
Next, the patient has no pulse and not breathing. Immediately begin chest compressions. Now in this scenario, patient has no pulse, not breathing, or gasping respirations. And this can trip you up because you may look at it and go, he's breathing. Take a look at this guy right here. That is not breathing. And gasping respirations can occur in the first few moments of a cardiac arrest. Don't be fooled. That is not breathing. Breathing is sustained ventilations rhythmically, 1 breath every 5 to 6 seconds, and we're looking for good chest rise. That's breathing. This is gasping, ineffective ventilations. Do not be fooled. Now, you're going to do chest compressions at a ratio of 30 compressions to 2 ventilations. Our rate for cardiac compressions is 100 to 120 compressions a minute, right off the test. 100 to 120. Our depth of chest compressions, how far we're actually going to push into the chest, at least 2 inches, not to exceed 2.4 inches. 2.4 inches. Straight out of the book, it's going to be on the test. Next, proper hand placement. You want the heel of your hand on the lower third or lower half of the sternum, above the xiphoid, but on the lower part of the sternum. If your hand is too high up, the ribs are too close together, you have the manubrium, you will never be able to get adequate depth. You won't get those 2 inches. So again, heel of the hand, lower part of the sternum. Now, as soon as the AED arrives, you want to get it on the patient. Expose the chest. The pads are going to go on the patient's perspective, high right, low left. And you're putting the pads on the chest with the intent of making a heart sandwich. The heart has to be in between the pads. If I got a pad here and a pad here, I'm going to defibrillate this guy's sternum. I want to defibrillate the heart. So a pad here, pad here, heart sandwich. It's your responsibility, if you're pushing that button and administering that shock, that you clear the patient. Everybody knows you're shocking, and you look from head to toe of that patient, make sure nobody's touching them so they don't get whacked too. Now, according to the algorithm, immediately after you provide this defibrillation, you want to resume chest compressions, do this for 2 minutes, then reassess the rhythm. Now, some AEDs are going to prompt you to do something else. For example, some AEDs, after they administer the shock, will prompt you not to touch the patient because they're reassessing the rhythm to see if the shock was effective. According to this text and this algorithm from the AHA, immediately resume chest compressions after defibrillation. Do that for 2 minutes, then reassess the rhythm. Now, if during the assessment the AED says no shock is advised, get back on the chest, continue chest compressions and ventilations until professional help arrives. So this has been a quick review of the BLS Healthcare Provider Algorithm. I'm Mark, thanks for watching, see you in the next video.